I'm very pleased to have Serena Scollen here. She comes all the way from the UK. Serena is a human geneticist, did her PhD in Cambridge, then postdocs in Cambridge and at Imperial, worked at Pfizer for a while and has been now for a couple of years at ELIXIR, which is the European Bioinformatics Infrastructure Network, a large S3. And there she's head of human genomics and translational data at ELIXIR. And very happy to have her here because she is one of the few people who really sees into all these European activities and has a great overview, and that is essential for the path that we are going to take, as Ollie pointed out earlier. Serena, please.
So thanks for the introduction. I'm actually going to go over many of the same concepts that Oliver went over in his talk, but in the European setting. I'm also going to talk to you a little bit about ELIXIR and some of the backbone services and the technical infrastructure that was in development and still in development to support some of the activities. But as the main remit is to talk to you about the GHGA project, I will also show you how far we've progressed. And it's good to see that in the audience, we've also got some of the members of the team with us as well when the questions get very technical at the end. So let me just start off with talking about ELIXIR. So we are a research infrastructure. Hopefully most of you have heard of ELIXIR. It's a federated sustainable infrastructure for biological data. So you can see here our member countries, of which we now have 22, and our 3 observer countries. So these countries hold the institutions and the networks, and we essentially bring those all together to sustain lifestyle, to support life science data across Europe and obviously beyond as well. So the way we're structured is in a hub and node structure. So I'm from the hub, which is based in Cambridge in the UK on the same site as EMBL-EBI. And we then have the nodes from each member country. So this could be, for example, multiple different institutions in a country that come together and bring together the experts, the bioinformaticians, the institutions that need to work together on the national roadmap for that ELIXIR node. And then we bring that all together so that we're moving in the right direction strategically as one. So I've put down here, do I have a pointer? Yeah, ooh, that's a crazy pointer. So I've put down here Germany, so you can see, hopefully most of you are familiar with the German node, but it's a really nice example actually because it's a large node. It's made up of 23 contractual partners and also EMBL Heidelberg. And so you can see essentially how quickly it scales to the bioinformaticians and the experts that are working within these nodes and then supporting life science data across Europe. We work to build informatics capacity and infrastructure in Europe. We connect and develop that network of experts. So you can think this scales to thousands of bioinformaticians. And we provide high quality services and resources to all. So you can see down the left-hand side here some of the activities. We're focused around developing some of the databases, the software tools, but also training, data standards, compute, etc. And then round the circle here, I can't control this arrow at all. There we go. We have all of the different areas of expertise in ELIXIR, and the ones that I'm going to be predominantly focused on are down here: the federated human data, the human copy number variation, and rare diseases. And also one we've recently added at the top, hopefully we'll bring it down in the circle to make it easier to present later. It's cancer data, and it's these 4 communities that form into human data communities. So I am intentionally going to ignore the rest of the expertise areas and focus on the human data, but I do want to make it clear that ELIXIR goes far beyond human data alone. We are structured in 5-year programs. We've now entered our 24 to 28 program, and we're structured around 4 specific tiers: science, technology, nodes, and people. So I'm going to, again, focus predominantly on the science and the technology side, but it's also important to realize that ELIXIR does a lot around developing the nodes for making sure that they're equipped for long-term operations, and also to develop people. So the people are there that will sustain the infrastructure and the services in the long run. If we don't have the expertise across Europe, then we will struggle to deliver against the science and technology ambitions. We also have 3 areas in this program. So we've got human data, biodiversity, food security and pathogens, and cellular molecular research. I'm focusing today on the human data and translational research sector, which I head up. Okay, now on to the more juicy mission, what we're actually trying to achieve. So this is really close to my heart because we don't yet have a sustainable infrastructure for human genomics data across Europe to support life science research and its translation to medicine. And as Oliver introduced me, I am a researcher. I've worked in pharma, I've worked in academia. The big struggle is trying to get hold of data to answer your hypothesis in a quick enough manner to actually make a difference. And I think this is the main inhibitor at the moment to actually delivering the promise of human genomics. So we've, since the sequence, we've had a few decades, there's been this huge promise. How can we deliver it? We're still far from the impact that we could deliver. So the vision for ELIXIR is to facilitate all of the different data management aspects, so from discovery all the way through to analysis, and to do that by linking it also, the human genomic data, to other data types. How do we link it to the health data, which was one of the questions earlier? How do we link it to imaging data and so forth, to be able to then get that data to a scale that researchers can really make a difference? So from my perspective as a researcher looking at common complex diseases, you need huge cohort sizes to really understand some of the susceptibility to disease. But also for rare diseases, when I was trying to find patients for clinical trials and for testing hypothesis in a pharma setting, you can't find those rare patients either unless you have massive cohorts. And then we want to also make sure that we are translating that research into medicine. And this is one of the challenges Oliver also spoke about this morning, that we need to bridge between the healthcare and the research setting to really deliver this promise in full. So we've been working across a number of projects that are helping to deliver some of this infrastructure. And just to point out that we expand from all the way through the technical services, but also thinking through what are the strategic and research innovation agendas that can influence the funding in this space and future development, all the way through to projects that are focused on preventative medicine. We're looking at some of the recommendations, some of the guidelines that need to be in place for developing infrastructure, and the technical infrastructure that needs to be in place for specific use cases, to making sure that that infrastructure fit for purpose. Talking of use cases, cancer is a big area. We have a number of projects specifically looking at infrastructure for cancer. And here at the bottom, the infrastructure for imaging data from cancer as well. We're trying to work with closely. We have a memorandum of understanding with the GDI project as well, to try and bridge these projects and infrastructure and the landscape together. So now a little bit more closely focused on the technical aspects. We are working towards having federated data. Again, concept that's been introduced this morning. This is a use case example from Finland. It's the same for any of the countries. We're looking at generating the data in a local setting. That data will not be able to move from the country it's been generated in. So it stays in the country, but is stored in a local repository. So this could be the local European Genome-Phenome archive, also already introduced. It's jointly managed by the EBI and also CRG in Spain. And then only a metadata will travel across into a central EGA. So this will be summary statistics that will help you to be able to find that data that's held at a national level, and the analysis will be taken to the data itself. So you can see this is then the way that we can scale data access, because the data stays at the country, the analysis goes to that data. And if you see on the right-hand side, if we manage to scale this to multiple countries across Europe, you're able to access huge cohorts. So staying with the Federated European Genome-Phenome Archive, the progress is actually quite substantial over the past few years. This is a plot from July this year, and it shows the central nodes, so EBI in Spain and the CRG in Spain and EMBL-EBI in the UK. But also you can see here the countries that have a federated EGA node already. Then beyond that, which I find really exciting, is the fact that in the dark orange, there are signed collaboration agreements. This means that real data can be deposited into these instances and accessed. And you might think this is insignificant, but when I come to the GHGA project, you'll see the scale of relevance here of trying to get the legislation in place across all these countries. You can see also federated EGA is not just focused on Europe, predominantly is developed in Europe, but we have a huge interest from global countries. So looking at Canada, Australia, South Africa, and many others that are interested in joining the federated EGA network. And this again is important because we need the data to come together in a global setting for us to really realize that promise of genomics. You'll also notice that not all of them have data that's available at the moment as well. So this is next phase of depositing data into these federated archives so that we can actually then allow the researchers to access that data. So just to reiterate the message, just to simplify the federation system, we have all of the data that's held within these access, there we are. So within these archives, so the EGA is an example here. We then have discoverability services. So the Beacon is one of them. So looking at how can you discover the data, it's essentially a Google for genetic variation. And then at the back end, we're developing compute environments that will enable that analysis. So the important thing to also note on this slide is the Global Alliance for Genomics and Health. So we're working very closely to deploy the standards, let me go back, to develop the standards with GHGH. This means that they are then globally interoperable, and we're then tapping into experts as well from not just Europe, but also beyond. So we're making sure that those standards are applicable across Europe and can be implemented, but also applicable elsewhere. What's game-changing for us in this? So we had the technical backbone in place. We know roughly what we want to do. We want federated systems, but how do we achieve it? Because if you think about Genomics England and some of the efforts in the UK, that's taken decades and it's taken a massive investment. But it's also had the political drivers behind it, which really made it happen. So this was then game-changing for us when the 1+Million Genome Initiative set out with very similar ambitions to ELIXIR Human Genomic Data Space, where they want to move towards cross-border access to genomic data and implementation of genomics-based health. This was initially launched in 2018. So there's a declaration that's in place, multiple countries signed, and 26 countries are now actively moving towards this cross-border access to genomic data. So we now have political driver in place and a national momentum. So I'll go through some of the implementation projects in a bit more detail, but just to show the roadmap that we're currently in. So we're now in an implementation stage. We've been through the design phase of the 1+Million Genome Initiative, and ELIXIR supported all of the and coordinated all of the implementation projects to date. So this is the roadmap that we've developed with the 1+Million Genome member state countries, whereby we have 5 implementation tracks. So just take you through those quickly. So we have the 1+Million Genome Framework. I'm going to come back to that in a moment, but it holds all of the guidance and recommendations for how to put infrastructure in place. We've then got a track for actual implementation of the infrastructure. So this is the GDI project that's supporting predominantly getting that infrastructure in place at a national level that connects up across borders. We've then got a track for how do we generate the data that's then 1+Million Genome compliant? How does it, a lot of the genome sequence data at the moment, does it reach the high quality data? Does it have the consent in place? So this is then a track to actually get to the data. We were aiming for 1 million sequences, which was ambitious because we know the data's there, but it's not all applicable to go into the framework. We then have national mirror groups. So these are at a national level, replicating some of the governance internally and driving forward contribution and engagement at a national level. And a question that came up earlier, so how do we align and integrate with the other initiatives that are forming in this space? So there are other infrastructures, the European Health Data Space is the obvious one. There's also imaging infrastructures and others that we need to make sure that we're compatible with. And you can see cross-cutting these are the use cases. So we have rare diseases, cancer, common complex disease, infectious disease. These use cases support our needs-driven development and allow us to continuously test the infrastructure, make sure it's applicable, so that research and innovation in the long run will be effective. We have the Genome of Europe. So this is a project that will start, actually kicks off in a couple of weeks, and we'll be generating a reference cohort across a European population. So it takes a normal population and it will hopefully generate whole genome sequences that will be compliant with the 1+ million genomes. But at the moment, we are working with synthetic data to test the system. And this is because we don't have the legal basis at the moment to actually use the real data, unless there's a previous agreement in place. So we do have one project that we're actively bringing in from the European Health Data Space pilot, which does have agreements in place, but we're a little bit limited to synthetic data at the minute. These are the projects. So we've coordinated from ELIXIR the Beyond 1 Million Genome project. This produced all the recommendations and guidance. We're now in the phase of scale up and sustainability. So the next phase of the roadmap and the implementation tracks I've just shown you. And this is predominantly being led by the European Genome Data Infrastructure Project, and the Genome of Europe project will start in a few weeks' time. So what does the GHGA project do? It fully supports the 1+ million genome initiative. If the 1+ million genome initiative shifts their ambition, we will shift with it. But at the moment, they're working towards the ambition to enable secure access to high quality genomics and affiliated clinical data across Europe. And they're predominantly looking for better research, personalized healthcare, and health policy making. So it goes a little bit further in the initial ELIXIR brief into the healthcare sector. It's a huge project, and it is 50% co-funded. So this brings challenges but benefits. So we have to have national buy-in, but obviously it's still a challenge. We have a huge number of project partners, 70, and we have 24 European projects that are involved. So I'll come back to the development later, just to show how we're structured. We're really focused around 3 main pillars. So the first pillar is around the governance and sustainability. So at the moment, we're looking to establish a new legal entity that will then sustain the activities going beyond the projects that are currently in the implementation. We then have 2 pillars that make it work and make it useful. So making it work is the technical infrastructure deployment. Making it useful is bringing in the federated analysis and the use cases. Where are we focused? So the countries have committed to a certain level of deployment of infrastructure by the end of the project. We're now halfway through, so 2 more years, and 15 countries will reach operational phase. So this means they'll have deployed a national node. They'll have all of the capacity that's involved. It will also be connected to EU services and able to provide data across borders following the 1+ million genome governance. And Germany, I have to point out, is in that operational phase as well. There are then 9 countries that will reach a slightly lower phase of deployment. So whether that be just not able to connect to the EU level, or whether it's just trying to address those initial national challenges for deployment. This is the user journey that we have at the moment. So at the top, we have the 5 functionalities that we're developing. So this goes from data discoverability through to the different data management components in the middle. So how do you store that data? How do you manage that data? How do you ensure it's secure? And how do you then enable researchers to access it, to process that data at the back end? So you see along the bottom, the GHGA standards that are currently in use for each of those 5 functionalities. Many of those will be familiar to you, I'm sure. And just to take you through the user story. So if you're a researcher, as I would have been a few years back, how do you actually know the data's there? You spend a huge amount of time trying to find the right data for your studies. So what we need is a data catalog. We need discovery services. So these are the Beacon and the Beacon network and the user portal. So you go in, you identify where your data is, and then you have a much more efficient way of accessing that data. So using life science AAI or REMS, it will go through a system of where you can actually access that data itself federated EGA is an instance of where that data might be stored. At the moment, we're working with synthetic data, and you'll be able to compute at the back end. Just to quickly demonstrate, so this is in development, but you would be able to go and have a look on the portal if you like. This would be where the genomic data catalogs and projects data will be held. So you can see, let me show you on the next slide, that essentially you go through, you identify the cohorts that you would like to access, you add it to your shopping basket, you check out at the end, and it's automated that it goes through the process for the data access committees. You get that response back, you can access your data. Straightforward. And this connects to the European Health Data Space as well. So the portal will be connected from the genomics to the European Health Data Space. I mentioned GHGH before, and actually you've mentioned the driver projects before, Oliver, as well, but we also have GDI as a driver project, and it's actually the first end-to-end demonstration of international database standards that are worked based upon the GHGH standards themselves. So as I mentioned, this means we have influence beyond Europe into a global setting. And we also are showing the value of our infrastructure by connecting Europe to global setting. Big question came at the end of the last question about how do we operate within the landscape, the other infrastructures that are developing. This is really key for us. We want to make sure that any of the infrastructures that are handling genomic data are fully aware of what we're doing within the European Genomic Data Infrastructure Project. And we're striving for interoperability across all of the different aspects, not just the technical infrastructure, but the governance as well. So connectivity here would be, for example, through the user portal. So this would be including support for EID and e-wallet, which then connects up to the European initiative level for European Health Data Space and EU CAIIM, which is the European infrastructure for imaging data. At the bottom, show the national nodes. So each of the national nodes, so Germany, for example, can develop their solutions. They could be national solutions as long as they're interoperable and have the standards in place. Okay, I know I'm running out of time. Too passionate about the subject, probably going on far too long about it. But one thing I do want to pause on is the 1+1,000,000 genome framework. If there's one thing you remember from the talk, I want you to remember this link because it holds all of the recommendations and the guidance. So if you're thinking about from a perspective of sequencing, what's the quality guidelines? So this would be at the top here, you go into the sequencing guidelines and you'll be able to see what are the recommendations and what are the guidance that for making sure that your data is 1+1,000,000 genome compliant. Similarly, for the data models, the standards and ontologies, and the technical infrastructure. With regards to the implementation, we have a whole section on the data governance. So this will also give you information about recommendations on things like incidental findings, and a section on the national implementation. So there should be a section here on Germany. I didn't check before I gave this talk, but I'm fairly sure it's fairly empty like the rest of the national centres here. But I should have checked that beforehand. But this is an area where we hope people, hope at a national level, they put bespoke national management practices, then other countries will be able to learn from. Another really interesting aspect here that you might want to take a look at is the genomics into healthcare. So we developed in the Beyond 1,000,000 Genome Project a maturity level model for countries to self-assess their maturity for using genomics in a healthcare setting. So this was through full Delphi reviewers. It's a very established maturity model where you go through all of the different components from ELSI, the different themes through technical infrastructure, so that a country can see where should they focus to be able to get to that next level of maturity and to moving genomics into the healthcare setting. So just to bring it to an end, hopefully spot on time. I'm seeing the flash ups of how many minutes I've got left. So I don't want you to think about the key to researchers to have genomic data infrastructure in place and have that sustained. Really critical is the sustainability part. Really critical is the experts and the networks that are needed to make this happen. And this is the same message, again, as Oliver said, between the healthcare and the research setting, that we absolutely have to get right and needs to change in the next few years for us to really deliver the promise of genomics. So we have data that's coming out of the healthcare systems. So genomic data previously was generated in a research setting. This is set to change, be generated in the healthcare setting. We need to work on infrastructure that brings that back out into the research domain so that academics and other researchers, clinical researchers, will be able to do the research that they need to do to understand disease and disease mechanisms. But then importantly, that needs to feed back into the healthcare sector as well. And we're not yet there and ready to do that. That needs a whole new wave of innovation. But I think until this whole picture is together and rotating in this infinity loop, we will not achieve the full impact of genomics to improve diagnostics, to improve treatments, and in the long run, move towards preventative measurements, preventative approaches as well for healthcare. So just to leave you with the thought that we want to transform European genomic infrastructure. We want to be able to access large cohorts for research. We want to use that to drive towards personalized medicine. And there's multiple activities that go through all the way to pharmacological hypothesis that will be able to really move forward this sector if we have access to these large cohorts. If you want more information, I'm around, but also these links are really important because they give you all of the information that you need on the projects, the initiative. I think the one, if you're going to scribble something down, I'll reiterate, is the framework, because that holds all the recommendations and guidelines. And there's also a blog I've just added to the side here, because I think one of the big questions that often comes out when I'm talking is what's the difference between federated EGA and the GDI infrastructure? There's a very nice blog that explains it. So feel free to have a look there. And thank you very much.